My name is Philip Dow, and I am an undergraduate student within the Faculty of Kinesiology and Physical Education at the University of Toronto. And the purpose of this video is to provide you, as a parent, with information on the signs and symptoms of a concussion and how to properly manage them in your high school athlete. Parental assessment and management of sport-related concussion in high school athletes. So let's get started. What is a concussion? According to the Merriam-Webster definition, a concussion is a stunning, damaging, or shattering effect from a hard blow, especially a jarring injury of the brain resulting in disturbances in function. In simpler terms, a hard blow or collision. Although most concussions are seen in contact sports such as football, wrestling, or ice hockey, a concussion can occur in any sport setting whether contact is part of the sport or not. So for example, soccer, basketball, field hockey, and many more. A concussion is an injury that is on the rise, especially in the high school population, and is especially dangerous because these athletes are still in a developing stage of their life, which puts them at greater risk for getting a concussion, and majority of the time, the athlete will get up and not even realize they are concussed because they don't know what it is they're experiencing, or they do know what they're experiencing and may want to continue play, so they don't say anything. This is why it's important to realize that not all concussions are assessed on the field of play, which is why it's important to look for changes in your child and make the decision yourself to take your child to get properly assessed by a clinical doctor. Listed here are some signs of concussions that are observed without diagnosis, and signs are things that are seen from someone else, or in this case, you. So we have signs of confusion, balance impairment, incoordination. They might experience some seizures. You will see deficits in their short-term memory, and there will be slight changes in mood, behavior, and personality changes. And listed here are symptoms of concussion that are experienced by the athlete themselves, and although a lot of the time these symptoms are suppressed by the athlete, in a sense where they don't know what is happening or don't want to report it, there are some things to look for or ask the athlete. So if you notice that they experience episodes with prolonged headaches, nausea, head, neck pain, disorientation, difficulty concentrating. You notice more emotional changes such as sadness, anxiety, nervousness, or other factors such as sensitivity to light or noise, and double or blurry vision. It's also important to realize that there are different types of concussion. So some different types of concussions here would be physiological post-concussion disorder, vestibulo-ocular post-concussion disorder, and cervicogenic post-concussion disorder. Physiological post-concussion disorder is the most common type of concussion disorder seen within athletes in this area compared to vestibulo-ocular post-concussion disorder, which is more focused around the vestibular and oculomotor systems, which is more focused around balance, eye movements, blurriness, etc. And cervicogenic post-concussion disorder, which focuses mostly on the neck region and headaches associated more of the back of the head, stiff neck, difficulty with range of motion, etc. Now moving along into the management of concussions, the first thing that should take place after concussion occurs is rest. Rest is important to reduce symptoms and hasten recovery time, and also reduce the risk of repeating a concussion and furthering your athlete's injury. This period of rest should occur until all symptoms are resolved at rest. It is also important to understand that this rest is relative to the individual because every single individual experiences different symptoms or different recovery times based on concussion. So this period of cognitive rest should reduce mental effort, so this may involve rest from school and a reduction or discontinuation of watching television, reading, using the computer, video gaming, texting, or listening to music on headphones. But although rest is important, it's important that rest remains within a 2-day time frame because prolonged rest can lead to psychological disorders such as anxiety, depression, and physical and cognitive deconditioning. Now, once these symptoms are cleared at rest, return to school is the first plan of action that should take place, and academic accommodations should be made for the individual in order to elicit reduced mental effort. So this may involve open book testing, pre-printed class notes, tutoring with a buddy in class, a decreased time on computer, and a reduction in workload. And in order to successfully transition back to school, frequent plan of care reviews should be applied, strong parental involvement is needed, and identification of an appropriate person at school to serve as a case manager, such as a guidance counselor, for example. Once your child has successfully returned to school, a return to play protocol should now be in effect, and it's important to realize that no return to play the same day as a concussion. This is because the resolution of symptoms before gradual return to play can range from 24 hours to 7 to 10 days or even longer, depending on the severity of symptoms. When managing your concussion, it's also important to take into account the categories of stress, so the symptoms and signs under the physical aspect, a cognitive aspect, and the sensory aspect, and the 4 aspects of life, so school, work, sport, physical activity, and social experiences with others, and the 6 stages of progression being rest, reintroduction to physical activity, low level physical activity, intermediate level physical activity, submaximal, and then normal regular functioning. This can be done by following the Zurich guidelines for return to play, which state that there's a 6-stage process that should take a minimum of 24 hours at each stage, and the athlete should remain asymptomatic before progressing to the next step. So no activity to light aerobic activity to sport-specific exercises. And if your child experiences concussive symptoms, you should stop there and return to that same stage the next day until symptoms are cleared up. And once those symptoms clear at that level, you can then progress to the next stage, which involves going into non-contact training drills to full contact practice and then normal gameplay. Now that is it for my video. I hope this was informative and educational and gives you a greater insight on how to properly manage and look out for signs and symptoms of a concussion within your high school